Michelle, you remember when we went on the workshop, when we did the workshop in Imperial Valley? Remember how exciting it was to see all the people there and realize that this information had never really gotten out about alcoholism and the signs and the symptoms, and that would really be wonderful to have a company or school districts do that today, wouldn't it?
You know, I think the thing that we did in Imperial County was so different and so unique. It sometimes it's even hard to explain in even to my clients presently what we did there. But we impacted an entire community over a period of 2 years. And basically it was through education. I mean, we did a lot of things in our workshops, but it was amazing how many people, when they were educated to the diseases of addiction and mental illness and how the families are affected, you know, it looked like we were targeting, you know, students at risk.
I think we targeted everyone, including several people there who started exploring their own possibility of being addicted or alcoholic.
Or their family members.
Or their family members, right.
And the other thing, too, was really shocking. It didn't matter if it was the supervisor, district, you know, the counselor, the
whatever position,
psychologist.
Yeah, whatever position they held, it was like we were all together.
Yeah.
So there was no hierarchy of, you know, I'm better than you, or I'm less than you, or that's the best way I've ever seen to approach a group of people to give them information. It really got to where we were kind of a second family after about 3 days.
Yeah.
They trusted us, and you could even see some of their family roles starting to come out as we talked during the day.
Yeah, that's true. You know, the family roles of like the hero and the mascot and the lost child and the scapegoat, and it was just like everybody reduplicated whatever their family of origin issues were. It was very clear that it was an experiment that actually worked. And what I was excited about when I saw you again recently, after you retired from the school district, is you told me that this program we designed still continues 25 years after.
It did. But what I also noticed in the job as a school psychologist is the addiction. I wasn't deeply involved with education with the addiction system, working with people as time went on. The ability or the treatment mode has changed some since 20 years ago. But the actual alcoholic addict, they're losing some of the connections and ways to deal with addiction that used to be a very viable way. Now today I'm noticing it's different. I've had even some of the doctors talk to me that are experienced, saying that now today the way to treat alcoholics has changed somewhat. Although I don't see that. What do you think?
Well, I agree. I don't think that the nature of the disease, you know, has changed, but I think the treatment, unfortunately, is getting diluted, and it's getting less and less directed, and then more and more because of our health care, money conscious, and what used to be programs that you and I worked in hospitals, outpatients, inpatients, they aren't in existence anymore. Over the last 20, 30 years, they're gone. And what remains is a little shadow of what used to be. Yeah. And in the outpatient programs, if they have any, they don't even deal with the families. And you know, dealing with the families when you deal with addicts or even any kind of mental illness is the key to helping somebody.
Yes, I agree. If the family doesn't change, the person that's in the family has to either somehow leave that family group, or grow with the family. If the family is growing. Now, if it isn't, they probably will relapse. There's a good chance of that.
Boy, is that true. And the other thing that's true is if they do not have support, that there is absolutely no way by willpower, I would say pretty much the majority of people could ever leave their family system or confront their family system.
So you do hear of people who say, oh, I don't need to go to those meetings, 12-step meetings. I did it myself. You guys are weak. Well, some people could make it possibly, and I've seen a few that have, but they aren't very happy. It's what we call a dry drunk. And I've seen people who are on the program who don't take and extend that program home with them and use it on a daily basis, become what we call dry drunks. So you can actually, the first part of treatment, first part of identifying that you're an addict or alcoholic, treatment is so important, or support. It doesn't have to be treatment, but to be able to go to a 12-step group and be motivated to get a sponsor, start working on the steps, are so important, just like it was 25 years ago. But I think people who have moved and evolved think that that old pattern of 12-step is now antiquated.
Outdated.
Outdated, antiquated, whatever word you want to use, it's being kind of set aside with these new forms of treatment that I'm seeing that don't include the family. Where they hook something onto your head or give you a medication that will break that cycle of addiction. Once it's broken, I think a lot of people can break the cycle, but to stay out of the cycle, support's the only way.
I agree. And the other thing is, there's 3 aspects of this disease, as you know. The mental, physical, and then the spiritual, where people actually violate their values. That's spiritual. It's important that all 3 of those things get addressed. And what I see is maybe the physical part's addressed, maybe the mental part, but very, very rarely. And there aren't really role models out there, long-term role models. And so you get a lot of people that have new programs out there that say they help, but it's like doesn't help somebody deal with the rest of their lives. And unfortunately, lifestyle changes are very difficult to make. The other thing that I notice, and maybe you do too, is how with families, families were actually the key to helping the addict, alcoholic get into treatment sometimes, because they're the ones that were suffering. They're the ones that had all the consequences, and believe it or not, they were enabling and they didn't even know it.
They didn't know what enabling was.
Yeah.
What it meant.
Exactly. And, as you know, I've done a practice where basically I try to help families, and I do what is like a slow intervention over time and help this family member understand they have choices. And when they take care of themselves, there are things that they can do that actually intervene. And the problem is the term intervention. Boy, that was real different back in...
But an intervention now, I think it's changed where it could mean a lot of things. Like you said, your model in the way you treat patients and families is to have them become more aware in levels of awareness. So when they first come in, usually most of your families that I've seen are in dysfunction. They're even resistant to go too far with treatment, with 12-step meetings. They're skeptical, they're suspicious, they're dysfunctional. So what I see is you set up the program to look at a level above and see if you can make it here without any dysfunction, come higher up in recovery. And most of the time that happens with somebody having some drama, for a better word. And then you look at it and say, well, here's the drama that we saw was coming, remember? And then you look at the second level, and you look up at the next level above that, the third, coming upward into a mode of recovery. And the third level, which could take a lot of time, and that's why it's important, I think, now to look at that as it's not an event, it's a process, so you stay with that process. So the third may even come after 6 to 8 months and you're still treating. They go, aha, it's an aha moment, where they go, oh, Michele, this is what you said might happen, and it doesn't feel good, what's the solution? I now am surrendering more to you, and more especially to the 12 steps, and people out there who are more than one person. So I see that. You get up to the 4th and 5th, and then usually people are in recovery, but you've taken a long time to get to that level. Some people go quickly, some don't. So you individually make your program support whatever level they're moving to, and it's real apparent by how they're acting, their behaviors.
It's a nice way to put that.
So that's what I've noticed in your treatment, and ones that are successful don't expect huge swings of sobriety or even being functional, because that doesn't come. It comes with time, being safe and slowly emerging. So that's good.
Is that true? You know, the sad part, and this is another thing I've noticed with the type of healthcare insurance, they only give so many sessions. It's like they call it quick therapy, or basically all they're doing is crisis counseling, and there's no ability for them to create any kind of a long-term relationship so somebody could develop that trust. And it's not about dependency on a therapist, it's about trust.
And probably when you have these quick fix jack in the box therapists, and I think they're effective if they know to hand off. If they don't want to keep somebody and they want to be the initial process to get people into recovery,
Yes.
they need to know that, but a lot of them don't know that. So they think if after 3 months this person isn't completely well, that something's really wrong with this person, and they get further into the mental health issues. So that's the part where after 3 months, looking at a person to see if it's the mental health issues or is it the sobriety, addiction being on alcohol or drugs,
Mm-hmm.
that's caused these personality issues, problems. So that's when the family really, after about 3 months, that's when the intervention starts, I think, because the person's sober and the family is no longer being as codependent, or they can't be, because this person's taking ownership of their life. So 3 months is a real crucial. So that's the start. And the problem with insurance companies that they won't usually provide support money for therapists after 3 months, or hospitals, or any kind of support. They look at it as Jack in the Box, McDonald's. You're going to go in and get a quick hamburger, and you're going to be out in life smiling with a Happy Meal. So I don't think Happy Meals are real readily available in the recovering community.
I want to add to a lot of people, first of all, they don't even understand for themselves, neither do their families, that addiction is the issue, unless they're really late stage.
Right.
Then it's obvious. But they start having really what appears to be mental health issues.
Right.
So they go into a mental health system, maybe a psychiatrist, maybe a nice family therapist, and they dish out the medicine for depression or whatever the symptom is, not even really understanding that there's an underlying issue that medicine will never take care of. And the problem is the patient is sincerely deluded.
Right.
And so is the mental health professional, whether it's a psychiatrist.
Well, under the DSM-5, the person could be categorized with a certain mental health disease. So you could go down and get 5 categories out of 8, and they could check yes, they're doing this, they're doing this. So then it's 3 or 4 months later, if the person just stayed sober, not everyone, but a large percentage just staying sober, maybe only have 3 of the category checked. So you have to know after the 3 months what's really left there. And they need to be treated in the moment too for their unease and for their mental health, but it shouldn't be stuck with a category as it moves.
Not only that, people who don't even know that they have the addiction going on, neither the professional
Right.
nor the person, when they're getting these pills that work with antidepressants
Yes.
and stuff, there's actually no desire and no investigation to see if there's anything further, because as you and I both know, very few alcoholic addicts really tell the entire truth. Not
Rare, very rare.
very rare. Okay, so they're telling the doctor, no, I just have a couple beers, when in reality a lot more of that's going on.
You and me know when someone comes to us and says they've had a couple of beers, and we look at this behavior, the two things match up and they're incongruent. So the problem is, I could take that person at their word and say 2 beers, and we wouldn't treat that patient correctly. So these professionals out there right now need to look and have the training to see how that matches up with the 2 beers. Wait, something's wrong here. This person's life looks like there's some drunkenness going on, some taking of pills, using of needles, getting high. So that's where we could come in to help companies become aware of when the alcoholic addict needs the certain type of help that MDs alone cannot give, or someone who doesn't know the disease can give help.
Another thing that we used to do years ago, because medical doctors were not given very much training, maybe a couple hours in addiction, and now they're given a lot of brain education, but they're still not extremely educated in the early and middle stages of the
Right.
disease. We used to, if you recall, we would not allow privileges in the hospital until they had gone through a program that another MD on the alcohol and drug unit had approved.
Yes.
So, and they were overseen, they were proctored, they were looked over a probationary period, so that they weren't inadvertently giving potentially addicting medications to alcoholics, because of course that would
Throwing gas on the
impair-
fire.
Yeah, that would impair their sobriety,
Sure.
right?
And then you would forestall getting a true diagnosis. That 3 months of cleanness, of not using drugs or alcohol, is so important to see what's really there.
Right.
So the initial people, the people who are the first responders,
Yeah.
I mean, that's a good way to look at it, that first responders, and there is a group of people who are, and then inadvertently, some of the doctors and therapists are first responders and they don't know it.
Yeah.
And that's where it's dangerous.
Yeah.
See, to go in there and know what you're doing, you're a good first responder because you have your fire hose and all your equipment. In other words, you're seen and know what addiction is. And the person presenting is so good at hiding it that that has to be done. People who are trained